Hello, my beautiful ladies. I've been receiving so many questions from you about how to wear heels healthy, how heels affect your spine and feet and ankles. And today I'm so excited to have an interview with Dr. Monica Saliu, co-founder, Tribeca Physical Therapy, physical therapist, and a woman health specialist, who will answer all of your questions in a greater details so we walk not only beautifully, but healthy for your feet, legs, spine, and your body. Thank you very much, Monica, for joining me today, and I'm very excited to have this interview and ask you many questions as my beautiful ladies have for you prepared. Could you please just tell us a little bit about yourself?
Thank you so much, Olga. Thank you for coming and joining us today at Tribeca Physical Therapy. I am so honored to answer all your questions. As Olga was mentioning before, I'm the co-founder of Tribeca Physical Therapy. I am a physical therapist for over 20 years. Graduated my degree in Romania. Moved here about almost the same amount of years, 20 years ago, with my husband. And I was working in orthopedic physical therapy ever since. A couple of years ago, I found my passion in women's health and started adding that to my specialty and expertise. And I decided with my best friend, Dr. Christian Marshall, we decided to open Tribeca Physical Therapy in 2019. The main focus of this clinic was to offer our community the highest level of care with individualized one-on-one, 1-hour sessions, patient-focused type of treatment. So we are not just treating conditions, we are treating the whole body, and we're taking into consideration the goals and everything that our patients are encountering in their life. It's not just if you're injured, if you're trying to start a new sport, or there's something that you want to achieve that is restricted due to musculoskeletal, any kind of dysfunction. We are going to be able to help those people to achieve their goals.
I actually got to experience that. I remember last year when I injured my ankle and I posted a story about that. You texted me, and actually I felt the magic of physical therapy, and actually I have never thought that I will need to do a physical therapy for my ankles. But after 1-2 sessions, I felt this magic, and I was like, wow, I learned so much from Dr. Bumi, and she helped me tremendously. So I was able to put myself back on heels and up and running because I was really stressed. I was very scared because it happened in the middle of the day. I was just walking, and in a snap second, I start to feel the pain, and it gradually started increasing, and within 1 hour, I just could not walk anymore. So
it is great that you actually reach out and you seek care immediately. That's one of the reasons why your transformative results were so quickly, and you were able to go back on wearing heels. And I hope you got to learn a lot about how to do prevention and how to take care of your body so you're not having those issues in the future.
Yeah, the prevention is very important. That's why, during my classes as well, I try to put extra attention to stretching just to make sure we warmed up, the feet and the leg muscles. And I wanted to ask, is it correct for me to do so?
Yes, not only if you want to wear high heels, you should do stretching in the end of any hard day that you use your legs a lot, that you walk a lot, that you exert any kind of stress on your body, or not even just like spending a lot of hours in one position. That could be sitting, using technology, being on front of the computer. You still have to do stretch and self-care in the end of the day to prevent injuries and for the best well-being.
Yeah, and why it's that important to put the care on the feet, about your feet?
Well, so our feet are pretty much the first surface of our body that touches the ground. So all the signals that there's being sent out to the brain of what to do and if it's danger, if it's fire, if it's anything that, or to teach our muscles to step forward, they're being sent through the feet. So it's the most important part of our body to be taken care of with regards to movement and gait and mechanics and pretty much standing up, right? If we would have been, we are bipedal, we are standing up in 2 feet, we are not we're using arms and legs to ambulate. So feet are very important to be able to pretty much feel everything that send the correct signals from your brain to walk, to step back if there's a danger,
or run, right?
Or run, or walk in high heels, or perform anything that we need to do to be active and alive, right?
Yeah, and actually what I learned from Dr. Bumi is when your one foot is not performing correctly, it affects your hips, it affects your spine and the posture, and then your hips are as well, what's it called? Like misaligning, yeah, and then this misalignment not only affects your overall look, but also inner organs. Is that correct?
It is. So our feet are the foundation to the rest of our body's alignment. And of course the joints, knees, hips, and spine, they're following based on how we placed our foot to the ground, which we're going to speak a little later regarding what is your posture in high heels, right? How there is a shift in center of mass and gravity when you are in high heels. So it's correct because the pelvis alignment is very much correlated to how our organs function. If our pelvis is misaligned and it's either anterior tilt, posterior tilt, it creates tension, pressure, dysfunction in our internal organs and how the flow of our body and function is.
Yeah. So our feet affects not only the way how we walk, but our hips, the posture, and the posture influence inner health and everything else. So I'm so looking forward to ask you a lot of questions about health of our feet and legs and spine. Let's dive into that.
I'm very happy, and I hope I get to share all my over 20 years of experience and expertise with you ladies. And
oh my goodness,
teach you as much as I can.
20 years, yeah. And the first question I'm going to read, because we received many comments from you, I would like to make sure I read it correctly. How to avoid feet pain wearing heels? My feet are really small.
Yes, that is very common because, as we know, the size of your feet and the height, they're very correlated. Sometimes, having a smaller feet and being very tall, it's a bit more challenging because it's a longer lever that you're supposed to sustain while you walk, right? So I feel like that applies to everything. Small feet or large feet, it doesn't matter. One of the biggest things that you can do is choose the right size of the shoes, right? High heels or not high heels, but high heels more so, choose the right size. So shoe size should not be too small, because what can happen if high heels are too narrow and too small, they can create joint compression, which gives a lot of pain, inflammation, and it changes the way you walk. You end up limping, you end up changing your gait, and definitely does not look elegant at all.
Exactly.
And it will give you injuries in the future and prevent you from wearing high heels.
Yeah.
So shoes, if the size is too small, that's one of the cause. If the size is too big, you end up shifting your pressure into the ball of the feet and in the front, creating a lot of compression there, but more so you have lack of stability. So there is not enough stability in the shoe, and the way you walk, it also gonna change. You end up dragging. So if the shoes are too small, you limp. If the shoes are too big, you end up dragging your leg trying to pick up the shoes with you, and that's another way that you do not want to walk that way, and it also causes injuries if you repetitively wearing high heels that way.
Yeah.
Performing self-care is very important. So as we mentioned before, stretching, rolling the bottom of your foot on a pressure relief ball. There are those teeny tiny, kind of like a golf ball with spikes on it. That not only releases tension on your fascia, but it also wakes up the micro nerves on your bottom of your foot.
Oh.
So, talking about that proprioception, which is in layman's terms, like for everyone to understand, proprioception is our nervous system feeling of where our body part is in the space. So when we talk about foot proprioception, this is what our brain knows what's happening to our foot, where is the foot in space, right? So if we have that kind of like thickening, numbness, tension in the bottom of the foot, our proprioception is disturbed. So rolling your feet at night before going to bed, stretching your foot and calf, massages whenever you can have them, they're amazing. And also, if you've walked on high heels very, very long, just soaking your feet and ankle in warm water with Epsom salt, it'll just do wonders.
Oh, wow.
You can do all those stretching and rolling right after that. So those are pretty much like self-care.
Yeah.
And the third, I think is very important with small shoe size or large shoe size, you really have to take care of your overall fitness, strength, and exercise. So you can't just expect that you can walk in high heels and not have a baseline fitness level.
Okay.
If you don't have it, you have to achieve it in order for you to prevent injuries.
I love that.
Yeah.
Yeah, it's a motivation to, keep your overall health.
Keep you
Go to the
moving.
gym, do yoga, dancing.
Right.
Yeah?
Right.
Okay. And the second question is, when I walk, my spine is straight, but my shoulders and neck are round, forward. What I do to not look weird?
Okay, this is a very common question for all my patients. And I think it has gotten worse ever since we started to move into the era of technology. So there can be multiple reasons why someone may have what we call forward head, rounded shoulders posture. And besides any kind of injury or any structural problem that may be, which I'm sure that everyone should get checked if there is any injury. If there is no other injury, one of the reasons that can happen is actually how we feel, right? So if we're sad, if we're cold, if we're stressed, we walk that way. So we round shoulders, we kind of like curl forward, and that becomes a second nature. So if that becomes consistent and we kind of develop into that tension on a daily basis, muscles in front of our chest become really tight, and other areas in the mid-back here become really lengthened and weak, right? So there's a lot of tension in the front, there's a lot of weakness in the back. And also being in that position doesn't allow you to really engage your core and to breathe properly. So if you don't breathe properly, you're not able to actually be upright. And actually, there's a lot of postural misalignments coming out from that.
Do I sit properly?
Yes.
Okay.
The definition of what means to actually breathe properly, engage your core.
Using the moment, I want to make sure the doctor can check how I sit.
No, definitely. Ladies, this is the way you're supposed to sit. No.
Thank you.
There is a reason why she's teaching you this, and she has a school for that. So that is, those are the causes why abnormal posture happens. It's how we feel, it could be muscle weakness, and also, lastly, but not really the least important, is how we work, right? So if we perform a lot of computer work and technology or on our phone, even looking at our phone all day long, you look down. And when you look down, you get tired. And eventually, you're going to end up getting more and more forward. Now, when you get up and walk, those don't miraculously start getting strong all of a sudden and keep you and hold you upright. So if you have a desk job and you work all day in that faulty position, abnormal position, it creates tension that you cannot really fight against when you're standing and walking. So what can we do to prevent that is more so first take care of our emotional state. Make
Yeah,
sure.
so it's like it's so important, like psychological,
Yes.
health.
You need
Mental
to
health.
you need to recognize when there is a fear, when there is an excessive stressor, when there is anxiety, and do something about it. It's not necessarily that we're all walking around happy and laughing on the street,
Yeah.
but recognize when that becomes your second nature, because that's something that you have to take care of it first. Then, as a result of that, you're gonna end up being able to work with someone or guided by a physical therapist to create postural correction exercises for yourself to carry on and make sure those faulty postures don't return.
Yeah, it's actually interestingly that you mentioned, mental health and how our emotions affect the body. Because every time I see after my classes, my ladies and my girls are saying to me, oh, I feel more confident. I feel more emotionally up. Just because we open the shoulders, just because we influence the way we stand, you already automatically start to feel better. But I do understand for sure, you need to make sure you're working on what's bothering you, why it's happening, why you feel sad. So it's a big, deep work.
It is. It's not like a one quick fix, and it takes maintenance, and it takes self-care. You can't just find a magic wand and all of a sudden, but baby steps. Taking classes, learning how to walk upright and how to keep your shoulders back. One of the reasons why they feel amazing is because to maintain that position, they do activate the muscles in their back, and they do have to activate their core. So by just doing that, it creates a little bit of a muscle memory for those muscles they haven't been used before. So then they have less discomfort or less challenge to be in that position. Tell someone to straighten up that they've been always working here.
Yeah.
They're not gonna be able to achieve it because their muscles are weak. But as gradually you put them in that position by giving them some corrective exercises, and they build up that muscle memory, then we'll be able to have less and less challenge in maintaining the position.
But you know what's as well, the question that I get a lot is when they put the shoulders back and the stomach is a little bit in to make sure that the spine is straight, they start to feel it hurts them.
But that's one of the reasons why it hurts, because those muscles are weak and they've been locked in a very long position. So when you try to shorten a muscle, they don't have endurance. So they
So it's
give up
good,
quickly.
it's hurting, right?
Well,
So it's like you're stretching
hurt,
a little bit.
There's multiple types of hurt, like pain. I'm always kind of trying to dissociate with my patients. I ask them, define pain. Let's talk about what pain is for you right now in this moment. Is it pain, discomfort? Is it sharp? Is it soreness from a stretched muscle or overworked muscle? Is it fatigue? Almost feeling like you did too many exercises and it's giving up? Is it a seizing up like a Charlie pose? That would be a muscle spasm. So let's find out from where that, what is pain for them at the moment, because they can tell you, oh, I actually feel this soreness. They probably refer to soreness. I have this discomfort once I'm in this position. Now we're talking about healthy populations. They don't have any injuries, because also sometimes when you try to put someone in an upright, perfect alignment, they may have some impingements that happens in that position. That's why their body ran away from that position. So that is for audience that they've had any kind of accident and they haven't really taken care of it, sometimes motor vehicle accidents or any kind of orthopedic injuries that they haven't really taken care of it properly. So they ended up finding a way of living that is in an improper alignment.
Okay, thank you. The question number 3. The
Let's see where we
conversation is
are.
so interesting that you want to talk more and open up every question more. After a feet injury, how soon I can wear my heels?
This is a great question, and I'm truly hoping that The person that asked the question, I am assuming that a lot of your audience, almost they're women, has been taking care of it. So after an injury, now we have to also define what type of injury, but I'm hoping that she's been seen by a specialist, either a podiatrist, since we're talking about feet, podiatrist or orthopedist. And my advice is also, even if there is not a big injury, they should be seeing the physical therapist as well, just because physical therapy is not all about just treating injuries. It's also about retraining the body to start functioning the proper way after you have an injury, even if it's short term, because we relearn to do things. When we have pain, we relearn to do things in a non-proper way, but we're just going by our day. So you don't want to continue, even without pain, you don't want to continue staying in that abnormal functioning of your muscles, right? Because what will happen in the future, you have a future injury, another injury, right? So you should be seeing a physical therapist just to kind of have an assessment, create a plan of care, and a maintenance, wellness, and prevention. But now talking about what type of injuries, right? How soon is, as a guideline, is like from my experience, what I would say is, if you're able to walk on uneven ground, which would count like sand, uphill, downhill, down the slope, if you can do those with no pain and no like proper alignment, then you should be able to try and start wearing your heels, not the one that you left off. You want to start with ideally a wedge and platform, smaller heel, and work your way up with endurance and also mechanics.
I love that test. So just, for me to understand and for audience to understand as well. For example, if someone had an injury, the way you understand it's time for you to put on the heels is if you were able to walk
on uneven surfaces, which that would be in the sand on the beach, or in the grass, or on soil, or uphill, downhill, take curbs. Do any of this walking with proper alignment and without compensation, so you don't look dorky and uneven just because you wanted to walk. Pain-free, then you can try.
You're ready.
Yes.
Then you're ready. But again, you need to make sure you start small. You don't go right away 4.5 inches, 5 inches. Small heel wedges and the wider heel, right?
Ideally start with a wedge and ankle support, because we're talking about foot injuries, and foot injuries are most of the time associated with ankle injuries, right? So if you have an ankle injury, there will definitely be a level of instability, returning to function, even if pain is not there. So to prevent a future injury or sprain or anything else that can happen, try to start with a wedge and start with something that has a little bit of ankle, either a strap or any kind of support.
And I usually advise my ladies to start with closed-toe shoes and make sure that the heel as well is closed.
Yes.
And now you're saying that it's on the top of that, if you had an injury, have some with a strap.
That would help initially to kind of get your body back to have that balance. And now when there are some other questions in the future, and I mean later on we're going to discuss regarding, we're not talking about just the ankle. So you have an ankle injury, and also we're not using just the feet when we walk on high heels. There's many muscles that is required for them to fire properly. So you walk in high heels properly, looking elegant, but also preventing injuries and not hurting yourself. So it's not just the foot muscles that are required to be strong and healthy when we put on a high heel. It's actually, there are other muscles that are more powerful and more important to function the right way, so we don't see abnormal gait, abnormal walking patterns, stumbling, knees bent, a bunch of
Let's go to the next question so we can learn all of that. What should I do if I have a feet injury? I think we partially answered that. To see a physical therapist specialist.
So first things first, within the 24 hours, you you should, no matter if you can move your foot, that means it's not fully broken, that it's not literally disconnected from the rest of the leg. If you can move it, you should do what we call vice, rest, ice, compression, elevation.
Oh, I love that.
So this is kind of like the first aid for orthopedic, especially lower extremities. It does apply to hands as well, but you want to rest the leg, you want to ice it, wrap it around, compress it so the swelling will subside, and you want to elevate it on a pillow higher than your heart. So those things are very important. You will be probably told to do those even if you go to emergency room. Now, this is immediately, right? Of course, if you have an injury that is severe, you just, while you call 911, you can actually ice it right there. But and then after the initial 24 hours, you should seek consultation of an orthopedist or a foot doctor. And then even if you are not referred to go to physical therapy, I do suggest you.
Yeah, because I was not referred to go to physical therapy by the doctor.
So here at Rebecca Physical Therapy, we do take care of acute injuries, but we also do work a lot on prevention, and we treat the whole body. So once you have a foot injury, as we were talking about before, everything else can change. And so we're addressing the injury, but at the same time we're assessing and look at the whole body, the way you walk, the way how you're teaching your ladies how to walk. We're actually checking to see what the body wants to do and how you walk, without, of course, putting a high heel first, and then they come straight to you, and then they learn how to walk in heels.
Okay.
Yes, so that's kind of the answer to that question.
Okay.
You really have to seek care and be proactive as you will.
Definitely. Thank you. Okay, next question. I have kind of pumped back around shoulders, can't hold a straight posture for more than 30 minutes. So pretty similar to the second.
We talked about this prior, but one more thing, it's actually giving details about like specifically 30 minutes. That shows that there is a very high level of deconditioning. So the person that asked that question probably does not exercise most of the time.
I see.
They don't have a proper core strength, and they kind of fall into this round posture for a while. So that's why the endurance got less and less and less. And so what she needs to do is actually to start like reversing all this. So she needs to seek care from a movement specialist, a physical therapist, or a personal trainer if she feels like, but ideally for postural correction you want to start with a physical therapist that does one-on-one, individualized, not go in and be seen by 4 people at the same time, or with another 4 people at the same time. Just to be able to have that individualized care, and also understand your body and learn to recognize when you're not in the right alignment. Education is number one, besides care. So care is, of course, we are in medical field, so we give and provide care to everyone. Education beyond the care is most important because it's part of prevention, right? It's the first thing that can prevent the reoccurring injury. So she needs to seek care, get into a proper assessment, have a program of minimal postural correction exercises, and maybe work a little bit on some cardiovascular endurance, some core work, and then she'll be able to maintain the position longer than 30 minutes. Okay, good. Right, 30 minutes is quite short.
It's short, right? Okay, good. I have knee problems since I was 15. Now still same. Long sitting is the worst. What may help?
This is very common in teenagers. So I assume that when she says long sitting, she means sitting for a prolonged period of time.
Yeah, and I think she refers that right now she's not 15.
Yeah. Definitely. So she may have experienced back in the days when she was 15 what we call osseous flatter, which I can't really specifically say that she had that, but from the signs and the symptoms that she was talking about, which is pretty much like a growing pain. That's how we call it in layman's terms. So that happens when the bones grows faster than the muscles are able to catch up and keep up with it. Now also the bones grows faster in the end plate, that's where the growth plate is, not in the center of the bones. If you perform any kind of impact sports, jumping, hopping, anything involving any of those, or you're sitting for too long, you put a lot of stress on the patellar tendon, the tendon that is between your kneecap and your tibia, the bone of the shin right here. Now, she's having those symptoms now when she sits for a long period of time, because what happens when you sit, there's a stretch on that tendon, right? When you stand up, that tendon shortens. When you sit, it gets stretched. So probably she hasn't really taken care of that when that inflammation happened back when she was 15. And there might be a little bit of thickening and scar tissue there from that time. So now the gliding and the stretching, so the shortening and the lengthening doesn't happen as smooth, right?
Oh, I see.
So she might need a little bit of care there to kind of take care of that scar tissue and have a better gliding of that tendon, so she doesn't experience those pains. Because I'm not sure how old is the person, but if it happens since 15, she will be experiencing it ongoing if she doesn't take care of it.
And then the longer you wait, the greater the pain you will experience.
Right, because also she's probably gonna wanna, wear high heels and yes. So she's gonna have more stress in that tendon and kneecap as she's trying and push herself to go through this without taking care of it, right?
Okay. Yeah. Okay. Good. Wow. Thank you. I didn't expect that. You dive really deep.
Those are like really valid questions that a lot of people experience, and they don't ever really take the time to seek care.
And to take care of yourself, right? Okay. The next question is, I rolled my left ankle many years ago, and now it affects my ability to wear heels. What should I do?
If I go straight forward, she should actually seek treatment, because going back to the previous growing pain type of injury, so rolling your ankle one time and not taking proper care of it, it makes you prone to roll it again and again and again. That's one. And number two, you lose full range of motion. So what do we need in wearing high heels? We need full plantar flexion, which is pointing your feet, obviously. And we also need stability. So those two, if they haven't been recovered fully, the same, and to have the same range like the other foot, she will have pain and instability and not be able to wear heels. So she should seek care. Yes, if she wants to get rid of the pain and be able to wear heels, she should see a physical therapist. Again, and I say physical therapist because if you go and seek a podiatrist consultation, this is great, because they will be the one assessing the pressure points and see if you have other problems that you may need, orthotics and other things. But when it comes to activity and stability and strength, you really do require that. So you can see a podiatrist and then go and see a physical therapist. Okay,
good. Thank you. Next
and I'm
question.
not saying that just because I am one.
I experienced that, and I'm so grateful that, I was able to treat the problem right away. Because I got super scared, honestly, because I wasn't able to walk. I was just like jumping on one heel, on one feet.
Foot, yes. This is how arthritis builds up, actually, and everyone thinks that arthritis is just for old people. Arthritis builds up from injuries untreated properly, because our body heals. It heals always. We're meant to heal. We just don't heal properly. And then we build up restriction, residue, and arthritis, which is calcium deposit and a bunch of other things, which they're gonna create a lot of trouble later in life. So the symptoms may be more exacerbated later in life, but the actual arthritis can start early in life when
wow.
you have injuries and you don't take care of it.
Oh wow. Okay. So make sure you take care about your feet. What if the ball of your foot burns when walking in heels?
Well, so what happens when you are in high heels? Your center of mass gets shifted forward. One cause that can be that the ball of your feet can burn. It could be the height of the heel that is inappropriate for your fitness level and range of motion of your foot at that time. So it's not the fact that you're never going to be able to wear it, is that you may not have proper plantar flexion, pointing, or you may have too high of an arch, or you may have weakness on your lower extremities, or the shoes may be too tight, probably. It works both ways. Even if it's too loose, actually, it makes you go all the way down.
Yeah.
So that might be one of the reasons. Or the second reason can be if the shoebox is too narrow. So if it's not tall enough, we talk about shoebox, the height between the platform, the bottom of your foot, and the top, where your toes kind of goes in. If that is too compressed and narrow, and your feet are not small, even if it's right length size-wise, but it's not the same, the right height size-wise regarding the shoebox, right? So that compresses your toes.
Oh, I see.
And it can create numbness or burning sensation. It could be numbness of your toes, where there is a condition called Morton's neuroma that actually.
Oh my gosh, it's like it's right now. I heard so many diagnoses already.
I don't want to go too much into details regarding medical terminology, but there is a condition that happens because of not wearing the proper size. And I'm not talking about length only. I'm talking about the narrow, the width, and the shoebox. So these are the things that you have to focus: the length, the width, and the shoebox when you buy a pair of shoes, right?
So proper shoes, it's the key.
Right, proper size of the shoes you choose is definitely the key. And if the stilettos do not apply for your arch, then you need help with that.
I see.
You need, I think one of your questions are also about that. You need inserts. You need specifically orthopedic inserts to create that proper arch that applies to that stiletto that you want to use.
Okay, go to the next question. Okay, next question is how to prevent ankle from twisting.
Well, how to prevent the ankle from twisting is pretty much like really strengthening your lower extremity. Doing plyometric exercises, which are the exercises that involves a lot of changing direction, movement, hopping, jumping, things like that. Those are exercises that you do with a trainer, with a physical therapist if you are in physical therapy, or within your workout routine. So staying strong, that's how you prevent your ankle from twisting. If you don't challenge your foot on different levels, like medial lateral, and you're just always walking in ballet flats, which by the way are the worst for you.
Oh really?
Yes.
Wow, I didn't know that. Yeah.
Well, it's like ballet flats, they make everything flat. Now, we have an arch, right?
Yeah.
So we don't necessarily need a full support of that arch, but you rather walk barefoot and maintain that arch versus going into a ballet flat, right? I'm not saying that everyone should walk in stilettos, but having a little bit of heel wedges on an everyday basis, or wearing sneakers when you need to actually walk a lot on your city streets.
Is it like the perfect shoes for your heel exist?
No, I don't think so.
Okay.
There is nothing perfect for anything, to
What
be
is the
honest.
secret?
And also, it's more choosing the right shoe for your foot.
Okay.
Because having a high arch is very challenging, and putting someone to wear ballet flats that has a complete high arch is extremely painful. And also, having someone with completely dropped arch in a ballet flat, they feel amazing while they are there, but with regards to their foot, but the rest of the body takes all the stress from it. So then you end up having knee injuries, hip injuries, lower back pain from walking with collapsed arch. So they will need support, obviously, and which a ballet flat doesn't really give you any support.
Oh, wow, no to ballet flats.
Go
wear heels.
There are some shoes that they have a thicker, all we want is a thicker bottom and also a little bit of support. So, you know, like the Oxfords and those kind of shoes that they give you a little bit of, it's not that you will feel every stone in New York City streets, right? Because those ballet flats are super thin that you literally, so we started from, I almost forgot where we started. We're talking about ankle stability. So that's what you need to do to prevent rolling your ankle pretty much. Okay. Strengthening.
Okay.
That's a bit.
Okay, the next question is the weight influences the height of the heel I should wear?
Great question. So the weight influences how much load we put on our lower extremity and especially your feet in general. The lighter the weight, the less work or load our feet have, right? But that doesn't necessarily mean that influences the height of the heel. What you do need to work on with regards to changes in weight, or let's specifically talk about gaining weight, right? If you have a strong core, in which kind of lifts some of the weight up, and you have strong leg muscles, then you can totally wear like whatever high heel you want. Now, the reason why is that when you wear high heels, obviously the center of mass and gravity gets shifted forward. So your muscles has to work really hard to take you back. And there is a level of compression that happens in the joints of our feet. So if you're able to maintain a proper alignment with stack, spine, in pelvis, and knees and ankles, totally fine to wear whatever heel you prefer to choose. It's more an ability.
It's all about the alignment,
right?
Making sure you're not leaning forward.
forward. If you can't,
you have a strong core.
Right. If you can't maintain that proper alignment, then you should not start with that height of the heel. You should start with a little one, wedge, a platform. One of the questions were about why platform would be better than regular heels. It's pretty much, the reason is, you know, the platform brings your heel at a very close level. So it's, instead of having a stiletto that the difference between heel and toe, it will be very high, with platform, the distance, the level between heel and toe, it gets closer. So if you have a 4-inch stilettos and you have 2 inches in the front that gives you a platform, then you become, it's almost like wearing a 2-inch heel.
2-inch heel.
So that it helps you to level up your shift of.
That's a little secret, a little tricks.
Yes, of course.
Okay, next question is, how long can you wear heels to not damage the feet?
Well, so heels, we wear them for beauty, right? For elegance. We wear them because it challenges our muscles. It makes us look slimmer, taller, longer legs, all this, right? All of the above. Now, there is no specific time that how long you can wear it. It's more about how do you feel after you wear them, right? Being mindful and kind of listening to your body after you wear high heels for, like, let's say an hour or 2 hours event, and see how you feel the next day and the day after. That's kind of your guideline that if that was too much for you too soon or not. There's no guideline, oh, you should just wear it for half an hour and then sit down for 3 hours. Yes, because it depends of your fitness, it depends of your level of comfort, it depends for how many years you've been wearing high heels.
And depends how strong your leg muscles.
That's what I meant about fitness. It's not general fitness. It's like to be able to have to stand properly in high heels. You have to have strong quadricep muscle and strong hamstring. Now the quadricep should not be weaker than the hamstring, the back of the muscle, the back of the thigh muscle here. Because when you're standing up and the heel is high, center of mass goes forward, your quad should be strong enough to straighten up your leg and send your body back. So it's not just the quad, works together with your core and the back muscles to keep you all upright. Otherwise, you would fall forward following.
And that's why we look down. That's why the gaze goes down. And that's why we actually created this perception of like insecure person, not super confident. So it's like so many things tied up with just your feet.
Exactly.
Right?
Body language really tells a lot about not just how you feel, but also about how your posture is and how strong you are and all that.
Yeah. All the secrets. Okay, so the next question. I spent my life in heels and now I have destroyed my feet. I cannot walk in them anymore. My right foot is in agony. I can only wear flat shoes now. I get injections to alleviate the pain. So this is like really severe comment, right?
That
severe
is
pain.
a person that probably didn't take care of the injuries when they happened, and she waited too long, and then she ended up going to the doctor when there was a lot of like lack of mobility and maybe some inflammation or arthritis accumulated, and she lost probably mobility of the toes. So in order to be able to be in high heels, you have to have mobility of your especially big toe, right?
Oh wow, really?
Yes. So you're gonna be here. Now the little toe doesn't require so much extension because it's short, right?
Yeah.
But the big toe is the one that needs a lot of extension to be able to be in high heels. It depends how high are the heels, right? Now if you have arthritis, built up arthritis from injury, your toe joint, the joint pretty much, we call it metatarsal over here, that connects your big toe to the rest of the foot, becomes stiff, and you cannot really get into that extension. And if you force it in that extension, it will hurt, and it will be throbbing and create more inflammation and more problems. Now the injection that she's talking about, probably she's having steroid injections, which they're pretty much to just alleviate the inflammation that is happening at the moment. But that's not going to increase her ability to be able to wear heels. It will just treat the symptoms at the moment. So in her situation, obviously, she needs to be seen by a specialist and work on improving that mobility and see the rest of the musculature that may be also compromised because she was not using them while she was treating all this. Yeah.
Yeah, to increase mobility, making sure the muscles are flexible, all the muscles because all the muscles are connected. You need to make sure you work with all of them.
Of course, yes. So strengthening mobility and finding the right shoe format, right? So it's style, I should say, the right shoe style. So not everyone is meant to be fitting in a pointy stiletto. They can wear stilettos, so they could be round toe, right? So she can try something that is a bit more round toe versus extremely pointy and on a lower heel, and like try that way if ever. But she, especially when you have built up arthritis or inflammation, the joint swells up, and so your foot becomes wider. So you may have started with having narrow feet, and then all of a sudden one is wider than the other. So then you need to obviously look for a shoe that even if it has heel that is really fitting where your new stage is, right?
Okay.
So she definitely needs to seek care. There are changes that you can make. It depends of how long ago was the injuries and how much damage it was done, but there's always changes that you can make.
Okay.
There's always improvement.
Okay, good. That's very hopeful, right? Okay, let's see the next question. Actually, that's question, perfect, nailed it. How physical therapy can help in preventing feet injuries?
Oh, so many things. Physical therapy can help on preventing not just feet injuries, but injuries overall and dysfunctions. And it can actually help to give you more awareness and understand your body, pretty much, starting from there. So you can actually know when things are not in the right alignment and learn how to do it and how to take care of it. And education is super important for that. With regards to feet injuries, yes. So first of all, maintaining a level of foot strength, toe strength, stretch of the fascia, rolling, strengthening of and stretching of your calf muscle and Achilles tendon, and pretty much making sure that your rest of the body alignment is where it's supposed to be, or as close as possible. None of us are perfect. There's always asymmetries between left and right. It's as long as our body function in a way that we don't have pain, we don't have to change our way of doing things, and also we're aware when we're not in the right position, and we know what to do if we have a symptom, right? Mild symptoms before it becomes an injury. That's pretty much what physical therapy can do and teach everyone. Yes.
Yeah, I think I cannot praise enough physical therapy right now because, it's magic. You're making sure like all your muscles are flexible, and I learned that the ankle muscles connect to this muscle and then this muscle, and then Dr. Boomi pressed something here, and I was like, wow, there is so many dots that I didn't even know that they connect into my legs and my feet specifically.
Our whole body is connected, and for us, for example, to be able to just bend over and pick up something from the ground or squat, we require to have a certain level of flexibility and mobility on the ankle joint, and that's the first one that starts. Like for someone to do squats, to do it properly and not injure yourself, you have to have a certain level of mobility on your ankle. And then from there, moving up to the knee and the hips. Now, when Dr. Bouvian was pressing here, she was talking about your hip flexors. The hip muscle is very much important to where the foot is as well. Everything should be in line, right? The pelvis, hip, knee, the kneecap should be in line with the space between the first toe and second toe when you do squats.
Then actually, there is a 3 walks that, for example, I teach, right? So the one is when you walk parallel, when you wear flats, because it's very natural walk. You walk parallel.
Relax,
if it's a sneakers, if it's a loafers, it's a boots, you walk parallel.
Right.
Then the second walk is when you put on the heels, you walk one straight line.
Yes.
Is it good for your body?
Yes, it is actually, and it's challenging for your body.
Yeah.
It's one of the most challenging walk that you can have to give to your proprioceptive system to do, so you're aging right. The wider the stance or the walk, the easier it is for our body. So that's why, for example, during pregnancy, women, as they get bigger and bigger,
they start walking.
grow, they start walking on a wider stance, and that's because they have to carry the baby, which has gotten bigger and which is a lot more stress on their body to stabilize. So they found their way to walk wider. The narrow walk, walking in line, this is the ideal way that we want everyone to try to be able to walk. Now, you're not going to walk like that
when you wear flats.
When you wear flat, but to challenge yourself to get to do that is very important to be able to do.
I'm actually so happy right now to hear that.
Yes.
Because for me, it's beauty. When I put on the heels, I always maintain in one straight line. It's adding to your elegance, to your overall look. But today I learned that it's the most healthier walk.
It's not the most healthier walk. It's the walk that if we are able to do, we know that we're healthy, right?
Oh,
so it's a training walk. It's something that is great to have the capability to do. We use that walk in our gates training when we train a patient that had a surgery and we moved away from the rehab part that is like sitting, lying down, and all that, and we started training gait. That we add that type of walk in our training.
Okay.
Because you should be able to have a high level of stability when you start walking. It's called tandem walk, right? Tandem stance is when you're standing with one foot in front of the other. Tandem walk is when you can actually walk in line, and it requires so much stability and firing from the hip abductors, which are the muscles on the side of our body, that we don't really get to challenge ourselves in our daily basis, because those muscles are mostly active properly if you do side stepping. We all, walk forward and we never really do anything sideways. So they get challenged when you're doing that type of walk.
Oh,
yeah.
then-
So if you're able to do that type of walk, that means you're doing great
You're
with
good.
regards to
Okay.
proprioception
Yeah.
balance.
And the third step is when we're crossing the feet, not one line, but you cross. Mostly, it's we use it in the runway, but still I teach that walk. How that affects?
So that walk is challenging in a way because it requires a certain level of internal rotation of the hips. So if you are stiff in your hips, you're not going to be able to do that cross, right? So it's a walk that is really giving you a challenge with regards to your overall fitness and mobility. So if you're able to do it properly without stumbling and without limping and hurting yourself, it's a great training to have for later for balance and proprioception, because as we age, we lose balance and proprioception the first.
Really?
We start, it's with that declines pretty much gradually, but over 40 somehow. I think kind of correlates to a little bit of decrease in muscle tone, even if.
So everyone
we
go
do
to yoga, ballet, dance, fitness, right?
Yes.
Right away.
Yes.
Okay.
So that kind of declines there gradually, but then that's why we need to do things for it to maintain it and to make
I
sure
see.
we're not losing all this type of challenge on your feet. There's a lot of people that they can, again talking about the crossover walk, there's a lot of people that can actually cross their legs because of limitation and restriction in the hip joint or the muscles on the outside being very, very tight.
That's a great test.
So if they can't cross their legs, it will be very hard for them to do the walk that you're training. So that is, as you said, it's a great test, and they will require more stretching.
Okay.
Yes, of the iliotibial band and TFL, which are the muscles on the side of the hip,
I see.
that actually lengthens when you're going across. So if they're very tight, what they will end up doing, they will move their pelvis, and they will look definitely not cute.
Yeah.
Walking
yes.
Sorry.
Yeah,
So,
everything is so connected.
Plus, also can create the lower back problems if they're using their pelvis instead of using their legs and hips.
Okay, next question. The next question, is the heel bad for your feet? That's like a tricky question.
Well, it's hard to say. I mean, obviously, we don't want to abuse anything, right? We don't want to abuse your body in any way, and our bodies in any way. So I feel like everything done in moderation can be done safely, but again, you have to be able to do it properly. If you're not able to do it properly, you rather not do it. So that's why you have to learn or also assess and see if this is something for you, right? So that's one reason why if you're not walking properly in high heels, do not walk in high heels.
I see. If you feel the pain,
it's also not only if you feel the pain, but also if you're looking like you should not be in high heels when you walk, right? If you're limping, stumbling, moving your hips too much side to side, or asymmetric from one side to the other. If there is any kind of, then you have to learn how to do it. If you can't, do not wear high heels.
Then come to our class.
And exactly. And again, everything should be in moderation. As we age, we have to make sure we're kind of like not abuse our body in any way, in any direction, right? You don't want to do just stretching, because then you'll be just loose and unstable. You don't want to do just strengthening, because you'll be powerful and strong but very stiff. So you want to balance things that you do on an everyday life. So same with being in high heels. If as you aged, you haven't really trained your body to be in it, and you're in pain once you put a high heel on for like the next 10 minutes, then you shouldn't.
I see.
Yeah.
I see. Then you need to do like
Then you need
exercises, prepare your body,
right.
and then put
go
back
back
in
and
heel.
try, yes. And
I
always start from a wedge platform and then stiletto,
I see.
rather than try straight
Right
up
away
in
stiletto.
a stiletto.
Yeah, that's, we partially already answered that question, but why I feel pain when I start wearing the heels?
Well, yeah, that's pretty much it because there is either a dysfunction, weakness, instability, or lack of range of motion. So one of those are happening on either both feet or one foot, and your body is not able to be in that position with ease. It's being forced to stay in that position, and then of course you're gonna feel pain, and then
I see.
you will end up
Yeah.
changing your posture because of it, and changing your walk, and everything else falls apart from there.
Yeah, again, first of all, a preparation, stretching, making sure you do physical activities, preparing your legs, feet, and spine, and then, only then you put on the heels. Beauty is not easy, right?
Definitely not. It's not easy. It takes work, like everything in life, to be honest.
But also, we were talking during our break about how to stay younger and how, for example, your feet affects all your body going to your face. For example, if your ankles are hurting, you start wobbling, and then your shoulders go in, right? And then it affects as well your face muscles. So all of that affects your inside health and outside beauty as well.
Definitely, it's definitely true. Everything that is related to our posture, which we already discovered that our feet are the first one that takes us there. Everything that's related to our posture and our well-being is going to affect our face and our aging, for sure. And everything that comes from its inside as well. So if you're not happy, you're not going to look happy. If your feet are hurting and you're not able to be in the right alignment and position, your face is going to say it, or your skin is going to call it.
Yeah.
And aging will happen like on a faster speed than
Faster speed.
Yeah.
Okay. Next question. That's a good question. Is there a difference on pressure when you wear platforms or stilettos? How it affects the feet?
Yeah, we kind of spoke about briefly earlier regarding the difference between like what exactly a platform is. But with stilettos, you have the inches that have been given, that how high the heel is. It's pretty much the distance of height with regards to your toes versus your heel, right? So all your center of mass is being shifted forward. Now, of course, your body should work against that and have a distribution between the toes and the heels, and that you do that with pretty much muscle activation. So it takes work.
Yeah.
With regards to platforms, because the platform is, you have a little bit of a height on the toes as well, and the heel, it decreases the difference between heels and toes. So you will have less of that shift, the easier way to fight against that weight distribution. So it's less challenging for people to use, right? So if it is for someone that hasn't had experience with wearing high heels or in general, you can wear a platform first.
Platform
to
first,
transition
yeah.
to stilettos.
Okay, good. Learn proper walk and then transition to
Right,
stilettos.
it requires less quads activation when you are in platform.
I see.
Because you're less inclined, right? So
Okay.
you don't have to, you can be a bit more relaxed. Not collapsed,
Okay,
relaxed.
relaxed. Okay.
Relaxed
Let me
in your
see.
walk.
Okay, next
Yes.
question is, I have just had a spine surgery a month ago. When can I start to wear heels?
Okay, so now I'm actually listening to that question more specifically. So she's saying that she had it a month ago. So definitely she has not yet gotten through her healing and strength and alignment fully, because usually post-surgery it takes an average of 3 months to get to
3 months.
Yes, 3 months to get to full activities, sports and everything else. Now, walking in heels is not a sport, but it requires a level of strength and stability and balance that can be taken to like right there with practicing sports, right? And now it depends of what type of surgery she had and how invasive and how much recovery time. So her physical therapist, which I'm sure she has one, she should post-surgery, should be able to assess that to see. But 1 month
And
is
then
too
I already
soon.
learned the
Definitely
trick.
too soon.
I already learned the trick. If you can walk one straight line without the pain, or if you can walk on even surfaces without the pain, then you're good to try back
You
where the
know,
heels.
for someone that has been in rehab though, it's a bit different. So if you haven't had injuries that they're like surgical, right, you can actually use that guideline. But for someone that has been in an orthopedic surgery, spine surgery, sometimes you don't see yourself if you walk right.
Yeah.
So she may be able to walk that way on uneven ground, thinking that everything is fine because she can see herself from the back, right? That's why she needs assessment. And sometimes the pain is not doing. It can happen the next day or a few days later and stuff like that. So when you're going through orthopedic rehabilitation, you need to make sure that your physical therapist is really assessing you for those and letting you know when you're ready to do certain things in your rehab phase.
Yeah.
And return
See
to
the physical
function.
therapist, and then the physical therapist will actually tell you
Yes.
the specific and
Exactly.
exact time
Yep.
when you can start wearing heels back.
Because
That's the
they are
best.
going to be able to do assessment and put you in certain testing and positioning that requires a certain level of strength, and they will be able to let you know if you're there or you have to do more work.
Yeah. The next question. Also, what size heels should I start with after surgery? Can I go back to pole dancing?
So let's first start with a heel. Again, very vague question regarding surgery. I'm not sure if it's
What
a
type
foot
of
surgery, it's what type of surgery in the body. So it's definitely she should start whenever she's ready regarding of if she's fully healed, right?
Yeah.
We consider everything is fully healed. She should start with a wedge. And
A wedge,
and,
yeah.
and then from there 2 inches and then work her way up. Don't go straight to 4 inches. Definitely
Okay.
not. So start
At
with the
pole
wedge.
dancing, they usually do like a 5 and more, right? Yeah.
So at pole dancing, they use platform, but the platforms are 2 inches platform
And the higher the
5 or
heel,
7
it's like
heel.
more
Right.
dangerous to sustain the balance.
Right. So talking about what type of surgery, very important to know to be able to have a right answer there. But I feel like everyone, even if they don't have surgery, they should have a proper movement and functional assessment, like to be able to like answer those questions. So everyone should seek
A physical therapist.
and not only just a physical therapist, someone
Pediatrician?
that works, a physical therapist, but the physical therapist that actually looks at the whole body and they're not just treating injuries. Even if you don't have injuries, you should have an assessment. That's when we feel like what we're trying to achieve at Tribeca Physical Therapy is pretty much giving our community the opportunity to have a yearly checkup. It's the same way how you go to your primary physician and you have your checkup to see if your functions are right with regards to blood work. Same
So you
thing
need to
when it
see the
comes
physical
to-
therapist every year.
It will be ideal because that's how you're going to prevent changes that happen anyway in your body, but you will at least be aware of it and what to do before they become dysfunction. That's kind of so before it becomes an injury and you have to go through the whole treatment, medication, and procedures and all that.
Oh wow.
That's why we do wellness here. So we're not just performing physical therapy. We're also having a wellness program. So when everybody graduates from the care through the physical therapy program, then we transition them to wellness, so they can continue working with us as we already know their body.
What is the program that you're talking about?
It will be a general strengthening and prevention, and injury prevention.
Oh wow.
So they will work with
Here?
us. Yes.
individually
with a physical doctor, a physical therapist, and performing a general strengthening and prevention, knowing their previous concerns that they've been already treated, and creating a program for them that is customized for their needs, and also observing them as they perform their strength training. So it's pretty much having like a specialized eye watching you when you're doing your strength training and conditioning.
Okay, good. Let me see one last question.
One thing that I wanted to mention that I'm not sure if your audience is aware of, but feet do change when you get pregnant. And as you go through pregnancy, and it's not just about the weight that changes, it's also a lot of times happens that there is a change in size. So I just want everyone to be aware, and that change in size sometimes, because I'm also a women's health specialist and we do treat prenatal, postpartum, pelvic floor in our other clinic that we have. So I would like them to know that sometimes that change does not always return to the previous size. So you need to be aware and just get the right shoes, pretty much.
Okay. So as we finish, is anything that I didn't ask or my followers didn't ask you that you think it's very important to know to prevent injuries, to take care of your feet, to take care of your overall health?
I think it's just, we covered a lot, but it's being proactive in taking care of your body and also being aware, learning to be aware of what's happening in your body and getting as much as information and education as possible to know what to do when things happen. I feel like that is the best knowledge that you can have. Just get all the tools to take care of yourself when things happen, so you're not, you don't end up injuring yourself and ending up going to the hospital, having surgeries, and increasing the cost and your expense, and also creating a lot of issues for the future, because surgeries, they may be necessary at one point, but they're the last resort. You want to avoid as much as possible. So every time you have a surgery, you have scar tissue, you have other things that happens after that. So you may get out of that immediate pain, but you end up having other pains afterwards in the future.
Yeah, Dr. Monica, thank you very much for answering all these questions. I learned so much, and actually through our conversation I got my reassurance. You know, I'm doing my work correctly, doing exercise, stretching before, you know, and I hope, my ladies, you learn a lot and you are going to take care of your feet, your hips, your legs, your posture, in order to stay healthy, stay beautiful, and stay as much longer young as it's possible. Thank you, Dr. Monica.
Thank you so much for visiting us and allowing me to share my knowledge and answer all your beautiful audience.
Thank you.